This is part 5 of 8 short videos in the Getting Started with Primescan 2 series. In this video, I demonstrate how to take a status scan with Primescan 2.
It's time to take our first scan. I will quickly introduce our new scan concept to you before moving to the score. For Primescan 2, scan concept features two different scan types, status scan and treatment scan. The main idea behind the status scan is having a dedicated workflow for capturing the current oral health condition of your patients, independent of a specific treatment. We encourage clinicians to make use of regular intraoral scans to build a complete digital record of your patient. The status scan can be used for effective patient communication, consultation, and basis for a later treatment. The treatment scan comes into play when you want to carry out a specific treatment, such as placing a new restoration. If a status scan exists, you can use it as a basis. In a restorative case, for example, you only need to rescan the relevant area of the preparation, which allows you to skip the initial bite registration and save time and discomfort for you and the patient.
We will start with the status scan, which is a great tool for new patients and checkup appointments. We recommend starting every consultation with a status scan. This can be easily done by your team. The status scan helps you to monitor the patient's oral health and have an overview of the situation. It's also very helpful with patient communication.
Today, we're welcoming Barry for the first time in our practice for a checkup appointment. I have previously introduced his name, last name, and date of birth in the score and created his patient file. I have no saved images or other data on this patient file yet. So what we're going to do now is take Barry's first status scan. To do so, I select Start Primescan 2, then select Status Scan. The status scan includes three catalogs: lower jaw, upper jaw, and buccal bite. An important point to remember is the scanning strategy. Start at the occlusal surface of the posterior teeth and move the scanner in the lingual direction to the other side at an angle of approximately 30 degrees. Continue on the occlusal surface, keeping the scanner parallel to the surface and in line with the arc. Let me give you some tips. Use the sound of the scanner to help you find your way around. If the scanner loses contact, it is probably because the surface to be scanned is not in the center of the viewing window. Then continue with the buccal view up to the opposite side, tilting the scanner approximately 60 degrees in the buccal direction and moving it outwards along the entire dental arc. If this is your first digital impression, don't worry. Remember that there's a learning curve to take into consideration, and to help you, feel free to use like support points on your patient's face, such as the chin, for example. When you stop scanning, the digital impression starts to rotate so you can see any potential gaps without touching the screen or a mouse. If you would like to stop the rotation, you can do so by clicking the right mouse button. In our case, the digital impression is complete, so we can move on to the next one. I double tap on my scanner, and without touching the screen, I can now move directly to the next catalog. Apart from the fun aspect of this feature, it's handy and saves in time. We repeat the same scanning protocol. Start with the occlusal surface of the posterior teeth and move the scanner in the lingual direction to the other side at an angle of approximately 30 degrees. Continue at the occlusal level, keeping the scanner parallel to the surface and in line with the arc. Then continue along the buccal view up to the opposite side, tilting the scanner approximately 60 degrees in buccal direction and moving it outwards along the entire arc. If maintaining the lower jaw position is challenging for the patient, an alternative approach is to use one continuous scan path in the anterior region, including the first premolars, without interruption. This method can help ensure reliable data capture while accommodating patient comfort. All that's left to do is the buccal registration. Just like with the conventional bite registration, it's crucial to ensure the patient maintains the intended occlusal position throughout the scanning process. For full arc scans, it is generally recommended to perform two buccal swipes, each covering at least 2 to 3 teeth in both the upper and lower jaws on each side. In cases where there are large gaps between posterior teeth due to misindentation, it is advisable to include the tooth distal to the gap in the buccal scan to ensure accurate alignment. You can enhance the status scan by adding clinical photos or activating the diagnostic aid for caries detection. While optional, these additions contribute valuable insights for building a comprehensive digital patient profile. Now, I would have all the necessary information, so I click Finish. Once the 3D model is generated, you can review it with your patient and highlight areas relevant to their oral health. If you identify the need for treatment, such as placing a crown, for example, you will be ready for the next appointment. Simply prepare the tooth and scan the preparation. It's that straightforward.
You have now seen how to take a status scan. In the next video, I will show you how to take a treatment scan with Primescan 2.